Joel Adams and Dr. Bachewich, welcome to the Tick Boot Camp podcast.
Thank you very much for having us.
Yeah, thank you.
We are excited to have the two of you here for many reasons, but we're here at the ILADS conference, and obviously it's because you treat Lyme disease, Dr. Bachewich, and you, Joel, have a product that has been used successfully in helping folks with Lyme disease, correct?
Absolutely right.
All right, so Joel, why don't you first begin by naming your company and describing how you started the company that is producing a product that is now presenting itself as a tool that's helpful for treating folks who are suffering from symptoms associated with Lyme disease.
Sure. So the product is called CellWel. The company is called, it can be found at CellWel.com, CelWel. And I came to this because I came from having COVID and taking this product for COVID, and then through a long process of figuring out that it actually helped people with long COVID, we then ended up finding out that CellWel seemed to be effective for other people with other chronic conditions such as long COVID, which brought me to ILADS a year ago to try to understand Lyme disease. Other than that, I had no previous exposure to Lyme other than coming here to ILADS a year ago.
Well, thank God you had not had any personal exposure to Lyme disease, and I wish that were a story that we didn't hear very often, but I think you and I may be the only two people who do not have Lyme disease here, at least today. So, Dr. Bachewich, my Canadian friend, welcome to the podcast. So talk to us about how you came in contact with Joel and his company and what you're using it for in the community of patients that you're treating.
Sure, yeah. So I met Joel about a year ago at the ILADS conference, came up to his table, knew nothing about the product at all, said, you know what, I'll give it a shot if he gives me a box. I take the box home. I had some pretty amazing results with my daughter who was suffering with long COVID symptoms. And over the next couple months, he kept kind of approaching me and saying, hey, would you want to do some clinical trial with your patients that have chronic Lyme? Because there's a lot of overlap in the symptoms of long COVID and in chronic Lyme patients. So I decided, yeah, what the heck, as a major skeptic coming into using the product and now seeing the results of it, I'm actually shockingly impressed by what we've seen. In fact, I've gone to him a couple times and said, are you sure there's nothing else in here? Because, you know, it does look, I would say, fairly unremarkable from the label itself, but it's the synergy between the molecules that are in there or something that is having a pretty profound effect. And I mean, it's not obviously on everybody, but statistically significant in about 3/4 of all patients that we did give it to. And these are patients regardless of whether they're doing IV therapies or antibiotics or they're doing special diets or anything. Like, there was no control for any of those factors. We just saw everybody in the group, for the most part, improve in some aspect or another.
All right, so let's build out your experience first as a doctor and then with this product. So where are you currently practicing, and is your practice largely a Lyme-related practice?
That's correct, yeah. So I'm in Winnipeg, Manitoba, Canada. I'm one of the co-owners of Nature Doctors, and we are the largest clinic in the province. But I'm not allowed to say specialization. My special interest in this field came because my wife got sick a number of years ago, and she's also a naturopathic doctor, and I had to learn how to help heal her. And so that's how I got into it. And then before you know it, next thing you know, word's spreading, and in the end, it actually, like, I've kind of become a little bit more of the go-to person in our area. That even, you know, medical doctors, naturopathic doctors, nurse practitioners are sending to me first to get diagnosed and set up a plan for them, and then they say, how can I help you? Yeah.
All right, so you've become, well, the Lyme-literate doctor.
That's right.
Who has a Lyme-literate doctor's interest because you're not allowed to be a specialist
That's
in
correct.
Canada.
Yeah.
And as a result of not being allowed to be a specialist in Canada, we're not going to suggest, Joel, are we, that he is a specialist in Lyme? But you are treating a lot of patients with Lyme in Canada.
That's all I do.
That's it.
That's all I do.
And where are you physically located? Are you in Eastern Canada or Western Canada?
Right in the center, right above North Dakota.
Okay.
Yep.
And so talk to us about, you know, how big a challenge Lyme disease is in Canada. I mean, obviously because our climate is changing and it's getting warmer, and the I guess the climate in Canada is becoming more habitable to ticks. I'm assuming there are more tick bites and more Lyme disease diagnoses.
Yeah, like the local Lyme support group that works in that area, they do a tick survey around our city, and there's a couple major parks just on the outskirts of the city. And their most recent survey, when they walked through there, they walk through down the paths with white sheets, pick up ticks, and then they get the ticks tested.
Yeah.
At the last one that they did, was 86% of the ticks were carrying Lyme. Now, we don't know what that data is historically, but I do know when I grew up, I was pulling 30 or 40 a day off of me when I was out on the farm. That was not uncommon, right? But now it seems like they are definitely carrying more and more diseases now. Environmental, there's a lot of reasons why. There's even agricultural practices that my family theorizes as to why it's spreading, but it is a hot spot if you look at the map of North America.
All right, so now let's distinguish acute Lyme disease from chronic Lyme disease. Right? And let's tease out the acute the acute diagnosis, and now the folks who have chronic Lyme disease. Now, when you have folks who have chronic Lyme disease, and now we're going to call it post-Lyme syndrome, or long Lyme. Yeah. When are you using Joel's product? Is it for all chronic patients, or is it for patients who are now resistant to treatment?
Yeah, super interesting. Okay, so for the study that we did patients that had it diagnosed by serological evidence for at least 3 months. So that was kind of the minimum amount, but some of the patients had it for 10, 15, 20 years too that did the study. Now, it's how I'm using the product itself. Based on the study and what we saw, we would tend to see that those patients that had a lot of fatigue, a lot of sluggishness, a lot of brain fog, those being the main symptoms, those ones tended to respond the best. The other ones that I tend to see a better result in were the ones that are very sensitive to medications. So the ones that can't tolerate antibiotics very well, the ones that can't tolerate dietary shifts very well, the people that can't handle a lot of stress, those are the ones that would come back and say, wow, I actually am doing amazing on it, can I get more? And so it was interesting, like from an Asian medicine perspective, I call it kind of a yin personality and an Ayurvedic, somebody that's deficient, somebody that is really run down. And in a lot of those long chronic Lyme disease patients, you'll see the reemergence of herpes viruses like Epstein-Barr, cytomegalovirus, Coxsackie virus, etc. And so this product in itself does also have antiviral properties too, which would make sense why there would be some benefit on those symptoms that we're seeing improve.
So the product, Joel, has both antimicrobial properties,
correct. Anti-inflammatory,
and antiviral. How about antiparasitic?
Yeah, I mean, there's a pepper extract in there, and even the Guducci root that's in there has been shown to have some microbe balancing effects on the body. Now, if the amount in there is able to do that, we don't know, but we are seeing improvements overall, even in some digestion in the patients.
So, Joel, talk to us about why you think your product has been successful first with long COVID and then now seemingly making the bridge over to long Lyme.
So we ran into some research by a company called Cimarron Research, which was investigating the difference between chronic fatigue and people who were healthy. And so they identified which molecules were being affected in which way when people had chronic fatigue and compared to somebody who didn't have chronic fatigue. But their research was not focused on how did the person get chronic fatigue. Was it perhaps from Lyme? Was it from COVID? Was it from some other source? They were simply saying people with chronic fatigue always have this happening at the molecular level. And our thesis has always been that we were affecting those molecules in a certain way so that they would not create the inflammation. Hence, we were focused on not on an antiviral capacity, but on an anti-inflammatory result from using CellWell that was beneficial to people who had chronic fatigue or brain fog, regardless of what the source was.
And we know that patients, sorry, I'm going to interrupt here, but we know that patients that have chronic inflammation, it's a feed-forward cycle, right? The inflammation blunts the receptors, blunts the communication within the body, to which more inflammation is a result of. And so if we can actually put a few pieces of the puzzle in to block that, then the body has a chance to actually kind of modulate the immune system and start to heal.
So what's happening is the inflammation is dogpiling on the inflammation, which is dogpiling on the inflammation.
That's right.
And that the totality of the inflammation is what's causing all the symptomology.
And essentially is the definition of chronic fatigue syndrome, right? It's the mitochondria just being basically slogged down under inflammatory processes, whether it's mycotoxins or heavy metals or viruses or whatever. But it's essentially the inflammation that blunts the response, a healthy response, and creates more inflammation.
And you think that's what long COVID and long Lyme have in common?
Oh, I guarantee that is a major part of that disease process. Yeah.
Okay. So, are you, Joel, are you working with any other doctors who are having similar results as our good friend from Canada?
Yes, one in particular, Destiny Green in New Hampshire, who is primarily a pediatrician, has given CellWell to a number of patients under the age of 21, some as young as 4 and 5 years old. And she also has seen wonderful results with CellWell for treating her Lyme patients who are underage. So yes, primarily there. We've also worked with Dr. Shore. Dr. Shore contributed a couple of, Dr. Samuel Shore, who contributed a couple of patients to our study, and we're here at ILADS to try to engage with as many more doctors who would like to enroll patients in this study. This is an open-ended study at the present time that we're going to try to enroll a lot more patients.
So I want to talk to you about not just your patient population, because you also use this with your own child, right? Mm-hmm. And you're certainly not going to use something that you don't think is safe. Well, you wouldn't use it with anyone. I understand that. I mean, and that would be what we'd expect from a doctor. But even if you were willing to take some risks in the patient community, you certainly would never take a risk with the most important person in your world, your daughter, right?
Yeah, exactly.
So that's a tribute to you and your belief in this product. Right. So why don't you give us specifically what was going on with your daughter, how was she feeling, and how quickly did it change after she started using the CellWell product?
Yeah, so I mean, essentially, she was an old lady. She was lying on the couch all the time. She had a
By the way, how old was she?
16 at the time.
16.
Yeah.
You look great for somebody having a child that old.
Thank you. But yeah, so she was lying on the couch all the time. She had a splitting headache, didn't really have an appetite, losing weight. Like I said, 3 months out of school, and she got
3 months,
and she was off the. She made it on the squad, the number one volleyball team in our province. Had to drop off that team through that process, and so really not doing well. And with everything that we knew and everything that we were trying, because I'm a naturopathic doctor, I mean, man, we were trying a ton of stuff on her. It's not like we just said, hey, take an Advil and hope this gets better. Nothing was really shifting the needle, and so all of a sudden, like I said, within a couple of days of taking it, the headache started to lift. The energy came back first, then the appetite, and then eventually the headache started to go completely. So that was kind of that light bulb moment where I'm like, there's something to this, right? And like I said, like I have no financial interest in this at all. Like I wish I did, but I don't. But it's the idea that the label is rather unremarkable. So the fact that I got that kind of a response, I had to follow up on this.
Yeah. So now your daughter, you shared with us that you began your journey as a Lyme doc. Again, I know you're not a specialist, but as somebody who treats people with Lyme, as a result of your wife's journey.
Right.
I'm assuming your wife had Lyme disease?
She did.
Do you believe your daughter had Lyme disease and COVID or COVID or?
I don't believe so. I mean, we did test both of my daughters multiple times, and it did come back negative. So there were other, like I said, Epstein-Barr virus and a couple other things that kind of showed up, but nothing that we had to treat per se. But we did inspect that because I know the transplacental transmission is a huge risk. But my older daughter was fine. My younger daughter was the one that had a severe reaction to the COVID. So yeah.
So Joel, do you sell only to practitioners, or is this a patient direct product?
So we do sell it off of our website, but primarily our primary distribution is through integrative medicine doctors and their clinics.
Okay, and if folks from our community would like to purchase the product directly, what is your website and what is the process?
CelWel.com, CellWel.com, and it's available. We ship it's obviously a U.S. site, but we ship to Canada, and that's That's where we are.
I want to thank you both for joining us here on Think We Can podcast. Thank you for doing the great work that you're doing, and I'd like you to please stay in touch with us because I would like to do a longer podcast with you so we can dig into some of the details that unfortunately time doesn't permit at the ILADS conference.
Thank you very much for having us.
Thank you.
Thank you
for having me.